started today. So welcome long-term care administrators and leaders from Alameda County. This call is, of course, everyone is welcome, but this is specifically geared toward RCFEs and is going to address some of those specific concerns and challenges that those kinds of facilities face. So with that, I'm going to turn it over to David. David, thanks so much for presenting today.
Yeah, sure. Thank you, Nicole, and thanks everybody for taking time out of your busy day to join us for the first in what will be about a 7-part series geared towards you and building your competencies and skills as a leader to both keep COVID out and mitigate its impact should it get in. We're committed to you because we're worried, quite frankly, about you and your residents and staff. For the most part, skilled nursing facilities have a wealth of resources and educational resources, and for the most part, RCFEs need more. And so we wanted to fill that gap by providing you with the latest of what we know throughout a series of webinars to help you prepare and help you prepare your staff for what's coming ahead. Here is a list of the curriculum topics that we hope to cover within the 7 or 8 weeks that we have with you, and we're committed to meeting with you every Monday at 2 o'clock. And today we're going to start with the basics of preventing and limiting the spread of COVID-19. And you can see next week we'll get into PPE. However, we can be very flexible around the topics due to the ever-changing guidance and what's happening with this pandemic. So we are going to devote some time today to talk to you about the vaccine, the COVID vaccine, because we know that that is probably first and foremost on your minds. So let's get started. So as you all know, this is a very, very, very tricky virus, and it can spread so easily. It can spread by someone shouting. It can linger in the air for over a minute. If you have a lot of dead space in your facility where there's no air circulation and someone has COVID and breathes heavily within that corner, it could hang out there for 3 minutes. So this is one of the trickiest viruses that you have ever dealt with, that I have ever dealt with. Much different than noro, much different than flu, much more complicated. So transmission-based precautions are what we utilize to keep your staff and residents safe due to the nature of this disease and how it is transmitted. You all should be aware of the core principles of COVID-19 infection prevention, and we'll be covering these core principles over the next 7 or 8 weeks. You know these, your staff should know these, but it's important that you keep this at the forefront in every employee break room, during every huddle with your staff. You want to make sure that you are well attuned on every single one of these bullets, and you want your staff to be able to answer numerous questions related to these topics to keep your residents and staff safe. Of course, your role right now is immediate action, an obsession around the guidance, and an effort to do more than what is minimally required. The facilities that are able to keep COVID out or mitigate its impact do more than is required by CDSS and the CCL. If they are required to test once a week, they test twice a week. If they are required to test their residents every 7 days, they test their residents every 3 days. They do more. They ask more questions at screening. They make extra efforts to keep it out. And that's what we're asking of you. These are very critical times right now with the positivity rate within Alameda County creeping up and up and up. And therefore, your staff are constantly exposed. And that's why we've implemented new health officer orders requiring you to test your staff. So we want to make sure that you're taking immediate action and doing everything you can to identify individuals who might be asymptomatic, pre-symptomatic, or symptomatic. You do so because you need to either quarantine or isolate individuals. You isolate individuals who are positive for 10 days or more. You quarantine individuals who are exposed for 14 days or more. In addition, hopefully now you've all really restricted communal dining, and with the Alameda County being the purple zone right now, you can certainly eliminate all indoor visitation and try to accommodate safely outdoor visitation. Transmission-based precautions are what you should be following should you have identified cases within your facility. And hopefully you're using all the appropriate cleaning and disinfecting tools, and you've added housekeeping staff to clean high-touch surfaces over and over and over again throughout your facility. Next week, we'll get into more information about the proper personal protective equipment that you should be utilizing and how to use the CDC tracker to make sure you have plenty of PPE on hand. Every single shift now, and even better, every 4 hours, you should be assessing everyone associated with your facility over and over again to determine if they have symptoms. Now, only about 60% of individuals with COVID have symptoms, but you still must be committed doing temperature checks of both staff and residents every 4 hours. So that means that you would check the temperatures of your staff when they come on duty, you would check them at their lunch break, and you would check them when they go home. In other words, do more to try to determine when someone may have the earliest onset of symptoms so that you can send them home. Be aware with elders, and especially elders living with Alzheimer's disease. They can present these symptoms in very unique ways, and really what you should be looking for is any change in condition. And any change in condition in your residence, you should be suspicious of whether or not it could be a sign that they have COVID. If they're grouchy, if they fall down, and they usually never fall down, if they don't eat lunch, anything could be a sign right now due to the high positivity rate in our county. Anything could be a sign that your resident suddenly has symptoms and you need to act appropriately. But the best approach to monitor for symptoms is to do it with vigilance and do it every 4 hours. The other 40% never show symptoms, and that's why testing is so critically important. And that's why Dr. Moss issued health officer orders that required RCFEs of 6 beds or less to do screening testing on all their staff, 25% every week. And if you're 7 beds or more, you are required to test half your staff every single week. In addition, you should be aggressively testing your residents, especially residents who go out for dialysis or go to the emergency room. Again, with the positivity rate this high, your testing should be increasing and being very aggressive, especially over the next 4 weeks. So increase your testing frequency to keep everybody safe. Testing is the only way to know who has COVID, who does not. Testing is the only way to know and catch individuals that are beginning their most infectious state so that you can isolate or quarantine them accordingly. Diagnostic testing is testing individuals who are symptomatic. Screening testing is what you're doing with your staff every single week to determine if perhaps one of them is carrying COVID and doesn't know it. And surveillance testing, of course, is widespread testing in the community, what we're doing in Alameda County. So here's a nice summary of testing and how you should go about testing. At the top, you see what triggers testing, and then we have a box or a column for staff and a column for residents. So if ever anyone presents symptoms, residents or staff, they should be tested right away. Anyone with symptoms should be tested right away. And ideally now, you should use a dual assay test to determine whether it's flu or COVID with just one test. So if you have a staff member who comes to work and they have symptoms, they should be immediately sent home, told to isolate and be tested. For residents who are presenting symptoms, they should be isolated and tested. When you have a positive case, that would be an outbreak. And when you have an outbreak, you are required to test all of the staff every 3 to 5 days for at least 14 days. Some guidance says test the staff every 7 days. CDC has always said that you should ideally test the staff every 3 to 4 days. Again, at this time, you should be doing more testing. So the more testing you can do of your staff, the safer your staff and residents should be. If you have an outbreak is defined as just one positive case under the residents. When you have an outbreak, you need to test all of the residents immediately, as fast as possible. And you have to test the residents every 3 to 5 days for at least 14 days. So to do so, you have to have a lab contract in place. You have to have trained, competent individuals that are available to swab your residents and staff and send carefully collect the specimens and send them to the lab. Anyone on this call who hasn't done any testing yet, you must be prepared. You must assume that you will have an outbreak if you haven't had one yet. And when you have an outbreak, the best way to contain that outbreak is to test everybody as fast as you can. And the only way that you can do that is if you have a lab contract in place and a mechanism to collect the specimens. So please, anyone on the call who has not yet done baseline testing, which is required by Alameda County, or if you don't have a lab contract, please pursue one right away. You will be affected by COVID if you have not already, and you want to be prepared. And then finally, under testing trigger is screening. As I mentioned earlier, if you're 6 beds or less, you have to test 25% of the staff every week, whether you have an outbreak or not. And if you're 7 beds or more, you have to test 50% of the staff each week. So you have to be actively searching for those pre-symptomatic and asymptomatic staff who bring the virus in and infect your residents. And the only way to keep it out is to make sure that you're aggressively testing the staff. For screening under residents, if you have residents who go in and out to dialysis, or perhaps they went home and stayed overnight for a family gathering, or perhaps they went to the ER and stayed 24 hours, these individuals you should also be testing. When they're exposed, you're not sure, but if they're leaving your facility, they certainly had a chance of being exposed. Now, skilled nursing facilities have to increase their testing of staff based on the positivity rate within the community. RCFEs do not. However, RCFEs would be very wise to be paying close attention to whether or not Alameda County reaches 10% positivity. And if we do, you would be very, very wise to start testing all of your staff twice a week as well. Again, not a requirement, but as leaders of communities with very vulnerable populations where individuals could die if they contract the virus, please consider doing everything you can to increase your testing frequency right now. So just a quick note about those health officer orders that I've mentioned earlier. You want to complete all your baseline testing by December 26th. So for those of you who have done no testing at all, Baseline testing is when you test everyone in your community to determine if anyone has COVID, and that is due the 26th. If you've had an outbreak and already done testing, you don't have to do baseline testing. However, you do have to start testing your staff according to the number of beds that you see here. And you can see this way, at least we'll test 100% of your staff each month, or in larger facilities, we'll test 100% of your staff every other week. In addition, we've tried to make things easier for you because Dr. Moss issued a standing order for coronavirus testing of residents and staff. So you don't have to try to get a doctor's order to get this testing done. You have an order from our health officer. So please, if you have an outbreak or if you have to proceed with baseline testing, you do have to get consent, but you do not have to get a doctor's order. This way, we can increase the timeliness of your response testing if you have an outbreak. Of course, after you get test results, the first thing you must do is communicate. Communicate with the primary care physician, communicate with the resident, communicate with their family, and communicate with your staff, and communicate with all of your constituents. It doesn't benefit you at all to hide these results. You must let people know what's going on. And then, of course, you take action. If someone is positive, you isolate them. You wear full PPE, and you isolate them for at least 10 days or more. For individuals been exposed, you're going to have them quarantined, whether that be a resident or a staff member at home. And of course, if you have a number of positive residents, you could do your best to cohort them, although that can be challenging in small RCFEs. And if it is challenging, then of course, you're not really cohorting, but you're giving a resident a status, right? And a red status would mean they're positive. A yellow status would mean that they're exposed or a person under investigation. And a green status would be on residents who've tested negative. So in some RCFEs, we can't really cohort by moving people around, but outside of each resident's apartment would be clear indicators of whether or not that resident had a red, yellow, or green status. And we'll go into cohorting in more detail in a future webinar. Dr. Hill did a great job 2 weeks ago of covering the challenge that we have right now with flu and COVID, because as you know, many of the symptoms are very, very similar. So you want to be concerned about both right now, and you want to test for both. And please bear in mind, individuals who are symptomatic and you don't yet know if they have flu or COVID or both, you can't mix them up. These individuals with symptoms need to be separated, treated individually, and tested individually. But certainly we want to keep them apart till we can determine who has what and what they have. So, as Dr. Hill illustrated a couple of weeks ago, to get ready, you certainly should get standing orders to take care of individuals who might have the flu by making sure that you have orders for testing and antivirals so that you can proceed immediately when you determine whether or not someone has the flu or if it's COVID. So again, the key is preparation. The key is preparation with consents. The key is preparation with standing orders. The key is preparation with lab contracts. The key is preparation with making sure you have individuals competent to do the swabbing and collecting the specimens. You must be prepared. You must assume that if you haven't had an outbreak, you will have one. We have about 70 RCFEs with outbreaks right now. So if you've been able to avoid it, good for you, but prepare like you're going to have to deal with it. So let's skip that. So, I want to make sure that, that your leadership has never been more challenged than it is right now. You're leading a vulnerable community in the middle of a pandemic, and I want to acknowledge how challenging that is for you, and how for you it should be inspiring you to put your best foot forward. And one of the ways that you can put your best foot forward is, number one, attending webinars like these and educating yourself about this disease and how to combat it. And number two, searching for information, being aware of where to find the best guidance and how to stay on top of that guidance and read that guidance. Your team, your staff is relying on you to be the most knowledgeable person in your community about COVID and how to prevent and mitigate it. So step into that role, if you could please, and educate yourself. And if you need any resources from Alameda County, we'll be sure to provide those with you. Number two, you should be huddling with your staff every shift to inform them, to educate them. If your staff are kept in the dark, they will not show up when you have an outbreak. So you would be very wise to be constantly huddling with your staff, making sure that they feel in on things, that they know who's positive, that they know who's yellow, that they know who's green. You got to calm your staff down. And the best way you can calm them down is to meet with them frequently, of course, safe distance, but meet in person so that they can see you and hear from you routinely. In addition, email your staff and provide them with plenty of written communication so that they can be knowledgeable in reading about what's going on in your community. In addition, your community could be the safest place during this pandemic, but it's only the safest place if people have the right PPE and they wear it appropriately. So please make sure that you have expertise in how to don and doff the appropriate PPE. Please make sure you have N95s on hand. Please make sure that you've done fit testing for your staff on those N95s that you have on hand. And of course, finally, if you have any confirmed cases, any positive cases, inform CDSS, inform us. We're here to help you and get you through it. Number two, make sure you don't let COVID in. Be obsessed with screening at your door, screening the staff, screening the visitors. Make sure it's done appropriately. I've been now in about 25 different nursing homes in 3 different states, and I've been screened 25 different times. Some have been weak, some have been mediocre, others have been excellent. Here's what I've learned. The ones that do it the best see it as a really important process to keep COVID out, and they're obsessed with it. So they check on it frequently to make sure it's done right. They make sure the staff who's doing the screening at the front door is well trained. They're competent. They understand the importance of their role. Screening of staff occurs throughout their shift. They ask the right questions, and those questions go beyond the minimum requirements. So questions you should be asking visitors now is, did you attend a Thanksgiving gathering? Where was it? How many people were there? So make sure your questions are appropriate in the context of what's happening in our community. And of course, audit this process. It's really important to keep COVID out. And one of the best ways to keep it out is to screen it out at the door. At this point, you can also be asking individuals coming in if they've been tested, where they were tested, and to show you their results. If you have COVID, make sure that you only dedicate staff to care for individuals in certain status. So dedicated staff to work with your red folks who are positive, designated staff to only work with the yellow, dedicated staff to work with the green. You don't really want a lot of movement. If someone works a double, you really don't want them to work with the red or positive residents and then work on the green side. If they were to do that, they should go home, they should shower, change their clothes, and come back to work. So please be aware, we don't want staff moving from a green resident to a red resident or a red resident to a green. We don't want people walking through your hallways who don't need to walk through the hallways. So you really want to minimize movement as much as you can when you're in the midst of an outbreak. Even though you're an RCFE, if you have an infection in your building and it requires transmission-based precautions, thus people have to wear an N95 respirator, OSHA will give you no break for not doing fit testing. Fit testing is required if you're using an N95 and if you have the COVID in your facility. So we've been offering fit testing classes, and fit testing is another way, of course, to keep your staff safe. So please, we can help you with fit testing. Look into fit testing. It must be done, and it must be done correctly. And then finally, visual reminders work. Make sure you have good signage. Make sure you have the proper signage in front of the resident's apartment or room based on their status, and the proper PPE to wear associated with each zone or status. If you have designated sections of red, yellow, and green, make sure that's clearly demarcated at the beginning of each area so that people can clearly recognize which zone they're entering. And of course, have interesting signs to remind people, and get out of your office and watch people wash their hands and do some observation to determine if people are wearing their masks appropriately, if they're washing their hands appropriately. Please, you want to increase the amount of time that you're spending in the community, on the floors, in the hallways with the staff. These are critical times, and you want to be as available as possible while observing to determine whether or not your staff and visitors and others are properly following infection control principles. Okay, I'm going to pause there and see if Nicole would like to offer any insights before we save some time for questions and talk a bit about the vaccine. Nicole?
Absolutely. Thank you, David. All good information. There's a couple of things I wanted to talk about, and one is that we've undertaken a project with David and his team. So over the last few weeks and extending through this week, the residential care facilities for the elderly, we've been delivering pulse oximeters to your door. And this is to allow you to detect if a resident is having a decrease in oxygen saturation and identify it before it becomes problematic, so you can seek medical attention. So some of you already received those. For the rest of you, they'll be delivered this week and maybe early next week. But we're doing it via contactless drop-off. So they generally arrived at your doorstep as if Santa were to have deposited them there. We want to thank all our community partners, and we want to encourage all of you to train your staff on how to use them. And it's very easy because there are instructions provided by David and his team inside the bag that you received. So please use those. Everyone received multiple pulse oximeters, so please deploy them throughout the facility. Of course, always cleaning between uses, but please use those materials. I also want to encourage all of you to be reading your PINs from Community Care Licensing. They have been issuing PINs at a pretty good clip recently, and there are critical information about some of these issues that David is highlighting. So I want to encourage all of you to be reading your PINs as professionals and to be keeping up to date on what they are saying, chiefly as it relates to vaccines. So David, before we get started, there's a couple questions here in the chat related to testing that I want us to sort of circle back to. which is in Alameda County. Can you tell us, and maybe Renee can drop it in the chat, what resources are available as it relates to community testing? And specifically, what resources are available for mobile testing for facilities?
Certainly. On the Alameda County Public Health Department website under testing, you can quite easily find our community testing sites, which are conveniently located usually in areas or zip codes with high positivity rates. But usually we have at least 4 or 5 community testing sites up and running every single day where your staff can be directed to go and get tested. There'll be no copay required. And those are convenient areas for you to direct your staff to go and get tested. In terms of coming on site and doing some testing of your residents, we do have some resources available at the community, for community on-site testing that we can deploy from Alameda County. Primarily, those are geared towards smaller facilities, usually 20 beds or less. We're particularly targeted to those facilities that are 6 beds or less, but we can do a little bit bigger if necessary. Those resources are in high demand. And so while we can deploy some help for you, ideally, we don't want you to become dependent upon the county for your testing needs. We can help you get started. We can do some response testing or baseline testing, but ideally, you need to be self-sufficient. You need to have a lab contract or your own contract with Bach or another mobile service so that in a moment's notice that you can deploy response testing if there's an outbreak. Should you rely on us, we might have to put you in the queue, and that wouldn't be timely testing. So really, we want you to be self-sufficient, although we do have some resources available. You can certainly reach out to me. Here's my email address. I think you can see it there, should you have any more questions related testing. In addition, we provided you a sheet with testing resources within the packet of that's in with the pulse oximeters. It's also an attachment to the health officer order that increased the requirements for testing. So we'll be happy to help you find a lab as well as try to help you with testing if we have the resources available to deploy.
Excellent. So David, someone else asks you talked about a standing order you had from the health officer to obtain, to get the vaccine and get tested. So you said, they ask if we have a standing order from Dr. Wong, is he willing to sign us up for obtain our CLIA waiver so they can get the test, so that they can set things up independently? Will this physician be willing to sign for their CLIA waiver?
Will our physician be signed for your CLIA waiver? I'm not sure about that. A lab director can sign for your CLIA waiver. So when you engage in a lab contract, it would be appropriate for you to ask the lab director of Avellino or Excel Talks or another lab company to sign on as the lab director for your CLIA waiver. That would be the best step that you could take to get that CLIA waiver done.
And again, just a reminder, Renee linked in the chat an information regarding the health officers and also where you can see the testing sites in Alameda County. So there's 2 different links. Please check those out. So David, before we transition into questions about vaccines, I wonder if we could talk about the recent announcement by Community Care Licensing regarding RCFEs and the vaccine and being auto-enrolled.
Yes. So just to be aware, you've all been auto-enrolled into a federal vaccine partnership that is being administered by CVS and Walgreens. And this is great news for you because it means that all your vaccine needs will be taken care of from what they say soup to nuts, meaning that within a couple of weeks, you're going to be contacted by a representative of CVS or Walgreens and be given information about when your vaccination clinic will begin. And so this will be exciting news, and you're going to want to be preparing for that clinic and be on the lookout for any emails or any telephone calls you get from either CVS or Walgreens. In addition, please Google CVS or Walgreens federal vaccination program for long-term care facilities. There's a wealth of information that's available on their websites for you. But I want you to be aware, should you have any concerns, that you are all signed up. And so these pharmacists will come on site with the vaccine. They'll administer it, the first dose, to your residents and staff, and then they'll come back approximately 2 weeks later with that booster dose that will follow the first dose. So good news. But really what you should be doing now, can you see my screen here, Nicole?
Yes, we can see your contact information.
Oh, that's all? Okay. Let's see. I want to share with you what you really should be doing now. Can you see my screen now?
Can.
And what is it, the AMDA?
It is. It's the information you sent regarding, talking about the COVID-19 vaccine.
Yeah. So really, as leaders, what you should be doing now is trying to prepare your staff to accept the vaccine and trying to prepare your residents and their families to accept the vaccine. So as leaders in the field and as leaders as these really vulnerable congregate living environments, you want to increase the COVID vaccination rate as high as you can. You want to try to get to 85% of your residents and staff accepting the vaccine. The only way that you'll be able to do that is by starting with education right now. And one of the best ways really to educate is not to just in service, but to start by asking your residents and families and staff to share their concerns, and then addressing those specific concerns with factual and scientific information. So please start to plan for forums where you can hold a Zoom meeting for families, where you can have a big open Zoom meeting for staff to educate them about the vaccine, how it will be administered, what the side effects might be. And here are some handy resources that I'm showing you from the American Medical Directors Association. They have an excellent toolkit with PowerPoint presentations that you can download for free, and we can send them to you as well. But it's going to take some work on your part to get to about an 85% vaccination rate. Should you get there, then you'll be in a good position of preventing an outbreak in the future. But it's going to take some work, and you're going to have to hold these forums and do some education. But much of what you need to educate your staff has been created. You don't have to invent it. And here's just an example of an excellent resource that you might consider. If you have a medical director, if you have a physician, if you have a nurse practitioner that works with you, make sure that you involve them and put them front and center in terms of these forums around education and support to increase the vaccination rate.
And to folks asking in the chat, so we will send this first of all was given to you in your pulse oximeter delivery, but we'll also share this document when we send out the recording and the PowerPoint slides, generally the day after. So tomorrow we will share this with you. David, someone notes, and we should have indicated this earlier, is, we're talking about RCFEs, but there's also ARF administrators on the call. And so just want to make sure we apologize for excluding in that conversation. We definitely meant this to apply to all of you. But there's a question here, and I frankly don't know the answer, which is, were ARFs automatically enrolled into the pharmacy program like RCFEs were?
That's a good question. If you were to send us your name of your facility, we have a list, and we can take a look to determine if you're on that list. If you're not, then we can certainly add you to the county list. There are some facilities, of course, that didn't SNFs that didn't sign up, or other unique facilities, and we'll make sure to set aside doses for you and your residents. So why don't you be in touch, and we'll try to determine if CDSS also signed up all the ARFs.
And I think it's important to note that you as facilities, your community is larger than just residents. It includes staff, it includes families, it includes volunteers, your facilities, there's a large group there of start thinking now about how you connect with everyone. And the same rule applies for the vaccine as applies to when you have an outbreak, which is communicate early and often, and assume that, anxiety is higher than normal. So begin talking about this and be willing to share, what you don't know, but also that you are part of these great calls and you're getting information from your associations and from your licensing body and from public health, and you are doing your best to understand things as much as possible. So, David, we are getting a question. I don't know that we'll know the answer to this, but sort of, are staff going to be mandated or required to have the vaccine? And I think the follow-up to that is, if so, then what do you do? So can you maybe speak to it, maybe just what you know right now, even if we don't have a full answer?
Yes, the COVID vaccine will not be required of your staff. And that's why there's so many resources being developed for you to help educate your staff to make a wise decision about getting the vaccine. It was specifically indicated with federal law that it would not be required. Therefore, states and local jurisdictions, I understand, cannot make it required either. So this is what makes it tricky, and this is why it's important to get a handle on the resources and education that you'll have to do in order to increase the uptick or the take on of the residents and staff to 85%. Can you see this slide?
We can. Thank you. Tell us about it.
Well, it just gives you a timeline, and it gives you clear indicators of either CVS or Walgreens, whoever you signed up with, and where they anticipate they'll be able to notify you and inform you about when your vaccine clinic will begin. And I wanted to show you that, let's see, the clinic, of course, there'll be a consent form as well, and I wanted to make sure that you're aware of the consent form. Some consent forms now are being developed to be much simpler than this. However, as you can see, just the consent form from CVS would require a significant amount of pre-work. So it's really important that you get a heads up and that you're tuning into the email that will inform you of when your vaccination clinic will begin, so that you can get all the pre-work done to be ready for that to be a successful day. And of course, as I mentioned, that pre-work includes education and support of your staff to increase the number of residents and staff who accept the vaccine.
So one thing I can imagine, as you guys know, everyone's so busy right now, is that it would be really important for you to start talking to your family members and those residents who are not able to make decisions for themselves, to start letting them know, hey, when I reach out to you, I will need a response within 12 hours. You'll need to prioritize this, because I think people will really want to prioritize their family member. They will want to, see them again, especially after, the sort of additional shutdown. So be telling them early that this is coming and engage them in the process. Don't wait till a day before the lab is scheduled to come to your facility. That will breed fear and a little bit of sense of chaos. So please be mindful of the communication and what information you're sharing and how you can instill confidence rather than fear. And I see another question about like, hey, after vaccination, will I be able to sort of stop doing the quarantine zones? And I think the answer is, COVID will not go away overnight. And so all of us will probably still be encouraged to still deal with COVID in our facilities, however that may come up. So while I don't know that I would get rid of the quarantine room right away.
Yeah, absolutely. Certainly not. I mean, we can expect that we will be managing our facilities to prevent and mitigate COVID through April. You should be planning on through April, because consider, you'll probably be the first to get vaccinated, but the world around you would not have been vaccinated yet. In addition, Alameda County and other counties are planning to create a permanent COVID division within the county, which means that this is not going to be a one and done virus. This is going to be something that we're going to have to get a vaccination for every year from here on out, and we'll still have outbreaks even with vaccines, just like with flu. Once you get your first shot, it's only 50% effective. You still need the booster 2 weeks later. So even after vaccination, you'd still have to be following the stringent of infection control practices. People would still have to be practicing source control with surgical masks, etc.
Yeah. And David, I see a couple questions popping up that I just want to run through, which is, what if they haven't signed up through the partnership? And I want to remind everyone that community care licensing, they sent out an email to licensees, I think week before last, which basically said that they auto enrolled you. So they did it for you. You simply need to respond to the email or phone call. And so that's really, yes, there was a cutoff, but CCL was wise and they did it for you. I'm also seeing question related to, what if someone's already had the virus? Will they have to get vaccinated? And I wonder if the answer is, that's the thing that your partnership with the pharmacy is going to handle for you, which is sharing with them if you have had outbreaks, if someone has had a prior positive test, that they'll be able to assist with.
Yeah. Right now, the answer to that question is yes. If they have had it, they will need to be vaccinated. But as Nicole said, you'll have a consultant pharmacist from either CVS or Walgreens that would also be able to handle those types of questions for you.
And the last question is related to, I think, sort of our understanding of the virus, which is they were saying that their residents' power of attorney is asking if after the vaccine, in quotations, would the person shed the virus? And David, I don't know if you feel comfortable talking about how this vaccine is different than prior vaccines we might be used to.
Yeah, what's really important for you to know and for your staff to know is that unlike the flu vaccine, where a very small amount of that virus is actually injected or part of the vaccine, that is not the case with COVID. The coronavirus is not in the COVID vaccine. Therefore, no one is being injected with COVID. So that's a very important differentiation between the flu vaccine and the COVID vaccine. So therefore, as I mentioned, no one is getting the COVID vaccine that has even the slightest amount of coronavirus within it.
Thank you, David. And I want to remind everyone, when we send out the recording tomorrow, along with the PowerPoint and the additional documents we've shown today, we'll also be reminding you that we'll be meeting here every Monday for the next 7 or 8 weeks at least to go over whatever we know that's coming up or questions you have. So feel free to bring those back.
Yep. And let's see, I also got the chat up. Yeah, just coming back to the quarantine room, really, it's always best to have a single room set aside. You might want to set aside that room for a new admission or a readmission that you would have to quarantine for 14 days when they arrive, or just having a place to place someone who's symptomatic while you're waiting for test results. So I don't think you should give up that quarantine room for at least another 6 months, I would say.
Mhm.
And anything that I showed you on my screen, we will make it available to you, right, Nicole?
Absolutely. If you could send me those final documents you displayed today, we'll include those in the follow-up.
Yeah. And please, as I mentioned, just be poring over the CVS and Walgreens websites for information about vaccinations and assisted living. Nationally, of course, RCFEs here are referred to as assisted living, so you might want to use assisted living in your Google search to get the latest information for CVS and Walgreens service to you. Let's see. Okay, well, we're wrapping up, and I just want to say, as we wrap things up, number one, thank you to Nicole. She's just a wonderful ombudsman, and we're really fortunate to have her, and the way that she organized the pulse oximeters to get sent out to you and distributed to you with volunteers. This is just another tool that you have to carefully monitor your residents to ensure that at the very slightest change that you can act quickly, be in touch with their physician, and give them the best care possible in the right setting at the right time. Mm-hmm. And we're also just really grateful for all of you for tuning in, for being caring and concerned leaders, to soak up this information on behalf of your whole community and all your constituents. You hang in there. You guys are the true heroes. And if there's anything that we can do to help you, we're right here, and don't hesitate to reach out.
Absolutely. Thank you, everyone. And thank you, David, for a great presentation today. We will see everyone back here next Monday at 2 p.m. And we will send out the recording with the slides tomorrow. And again, feel free to encourage other members of your team to register. Have a great week, everyone, and please stay safe.
Yep. Thanks. Bye-bye.